be the drone eversions under here, and you'll get to see how to evert the drone. And on the tip of that eversion, you'll see the stuff that we're collecting, which is the semen. And that's when we move to this equipment here. It's how we collect the semen. We have a tip there, which is where it'll be collected. And then this hydraulic system is charged up with saline. And it was first cleaned using ethanol, because this is like a surgical procedure essentially, right? Everything has to be very sterile and as clean as possible. This really isn't the best environment for it, but it's pretty good for educational purposes for now. But as you can see, I'm super high tech. I only buy the best. This is just a Bic pen that I pulled the thing out of, the ink. And inside of there is our pipette. You can see it has the blue mark on it. Whenever I collect enough semen to hit that, I have about 100 microliters, at which case we can take it up to the room, and you'll get to see that after lunch, actual insemination, if you're interested. But if I wanted to, say, save this or ship it, I could pull this out of here and cap off each end with Vaseline, which would pretty much hermetically seal it. So, and then we just got some tubing, and then this is the expensive part here. This is a syringe that allows me to very specifically dose the queen with semen. We do about 8 to 10 microliters of semen per queen. And that can take a lot of drones to collect that many. It really depends on the quality of the drones as well. Some have a lot, maybe 1 to 2 microliters each, and some very little to none. And I think Apivar might have I don't mean to amatraz, might have a role to play in that, because some studies have shown that it reduces drone fertility, actually. Yeah. But here's a diagram of what we'll be doing. I can show you in real life once we get some drones too. But this is the drone, and this is the what we evert out of the drone. So it's literally his innards just come out of him, and he perishes in the process of this. But this is the endophallus. And then these are what we call the horns. You'll get to see those. They have an orange tint to them. And up here, you'll see a little ball of marble colored stuff, and that will be the semen, the thing that we're collecting. And while I'm everting this, you do not want to touch any of this. You want to keep it as sterile as possible, otherwise it could infect your whole system. Oh, thanks, Steve.
You want a black one or a brown one?
I'll take that one. Thanks. So here's the drone. This isn't for the faint of heart, really, so viewer discretion is advised. So typically I would be doing this a pad of ethanol here to clean my hands and stuff like that. But I start by I pull his head off just to end him there. And then euthanize. I like that word, yeah. And then as you can see, there's the partial. Now this guy looks a little immature. Typically those horns should be orange. And also he feels a little squishy. After you do this partial eversion, we call this, you should feel his abdomen, which is what the endophallus comes out of. You should feel it get rock hard, actually. And that's how you know it's going to be like a really good producing drone. So then we'll try to do the rest there, and yeah, that didn't really work out too well.
Too immature.
Too young. Yep, too immature.
Get bigger ones.
Sorry.
Thanks, Steve. A life cut short.
Yeah.
So here, let's try this guy. It's all in the name of science, right? So see, that looks a little better. See the orange tint there? And then we'll try to get the endophallus out, and there it is. And if you look very closely, I'll try to show you under this microscope here as well. Hello. Maybe.
Oh wow.
And right there at the end, oh, is that turning out okay?
It's beautiful, yeah.
That's the semen there at the end. It kind of has a marbled look to it. Oh, where'd it go?
That way.
That's why I don't do that's why I'm not on television.
Towards you.
There we go.
There you go.
There you go. There you go.
Yeah, and there it is. Yeah, that ball on the tip there.
Very good.
And then that's the Endoalis. Right there.
Mm-hmm. Wow.
And then that thing that kind of looks hairy. Right there, that's the hairy patch. That's actually, I think, part of the mating sign that would remain on the queen after the drone mates with the queen midair. They actually mate, fall backwards, you know, in bliss, maybe, I don't know. And then they leave the mating sign there, and it actually, I believe it has like ultraviolet properties to it, so that the next drone coming in can actually see that essentially glowing, because bees see in like the ultraviolet spectrum, right? Thanks, Steve.
So when the next drone comes in, what happens to the sign that's there? Does she spit it out, or does
I believe he kicks it out.
he kicks it out?
She doesn't spit it out.
Yeah,
No,
there's a joke there.
eject
It ejects it, yeah. Yeah,
She ejects it, or the next
he
drone?
does. When he comes on and he's mounting,
Clawing at her.
it's ejected.
Yeah, and this all happens pretty quickly too. She'll mate with, on average, about 15 drones midair. I might try to collect some semen
Minus
real
the
quick,
whole
actually.
headless thing, that kind of mimics the nature of, you know, that phallus will come out. And
Yep, exactly. So he would evert, you know, naturally inside of her.
gotcha.
But yeah, instead I do it with my
Yep.
thumb and forefinger there. Yep.
For the next round, next color.
That's set. And I'll just evert another one. So here this is a saline solution that it's charged with. And so I'm drawing up a little bit of air. Then I'm gonna put in another bubble of saline. There we go. And we're all set. You also want to, I also like to use a lot of saline in the tip to begin with, and you don't want to mix the saline and semen too much, but you don't want it to get dry either, because the tip on this needle is very small, and the semen will dry and it'll clog up your tip, and it's very hard to clean that out.
How much is a new tip?
I think you can get them for maybe $5 or $10 a piece. Yeah, not terrible. Some people will actually, yeah. Some will make their own. You can buy a machine to do it, and
But if it dries up with a load of semen in there, you're just lost. You can't.
right, yeah. So yeah, you want to keep things pretty wet if possible. And then this is what we collect them in. I think, is this a butterfly cage technically,
Yeah,
or
something to that effect.
something like that? Uh-oh. Fred,
One.
that was you.
Everyone looked disappointed. Where did it go? What is going on?
You
That was
like
the
your
one who
hair?
brought it. That was the mature one. He's like, I'm out. I could do better in
saw
that.
what
I could do
happened
better in nature.
We're still depressed.
All right, we got one here. So again, I'll try to get their legs out of the way. Because even if it touches their legs, it could be, you know, there could be bacteria, something on there to make it not sterile. Yep. And then boop, there's the eversion. And I don't know if you guys want to come, you can come get a close look at that if you'd like. Yeah, you can see it right on the tip there.
What are we looking at?
Yeah,
It'll be
the semen at the
white
very
with like
end
a
of that
salmon
tip.
colored.
Oh my gosh.
Yeah, it's almost kind of marbled, beige, white.
And did you just squeeze that out?
Close
or how
up
did
for the
you get
camera
that?
there.
Yep. Just squeeze it
Yeah,
out.
yep,
The
squeeze it out. Kind of like a, you gotta think of it almost like a toothpaste tube. You don't want to squeeze just flatly, but kind of.
A very small percentage of what's actually on that ball that you see there. So you've got the horns, you've got the ball that's there that looks like marbly. If it's clear, then obviously it's immature, but if it's that nice milky white, and then if you look even closer yet, and Fred, you might be able to zoom in, and there should be a salmon beige portion of that ball, and that's just the small section. Everything else, there's mucus on there. You don't want to suck that up in there because it dries out. It's a very delicate process.
Lots
Yeah.
of practice, I'm guessing.
That's why
Lots of
that's why
practice,
II
yeah.
queens are very expensive, because it's a whole big process to get to that one queen.
Absolutely. Yeah, I had to
And
go
you
through
go through 50, 100 drones just to get a pipette of
Easy.
15 microliters, which will essentially inseminate one queen.
Wow.
Yeah. Yep, absolutely. And I had to go through a lot of training to do this too. I went through Penn State EPIC program, and I also went out to Apis Engineering out in Indiana to learn from them as well. Great people.
company.
Oh yeah, Dale and Crispin. So
They make
typically,
big units too.
they're the Cadillac unit, really.
Just
Yeah.
like Pro Photo Gear. That's great stuff.
Yeah,
You're
really
willing
nice
to
stuff.
invest. Yeah.
I've been in Dale's machine shop. He has beautiful CNC machines, makes them all there. Really nice stuff. Yeah, and he's an engineer, so he's really tuned in all that stuff. And so typically I'd be doing this under a microscope, but
Is there any?
there is a nice ball of semen there. So I have a little bit of saline in the tip there. I'm actually going to eject that out onto the endophallus. And then I'm going to very lightly start to suck up the semen, hopefully. It's kind of hard without a
A
microscope.
microscope makes it much.
Yeah,
Even a
But you-
magnifier would help. huh? Or
It would
no?
help, but
Jeweler's loop?
with the microscope, it's such a small margin of error. If you push too hard, you end up getting a lot of mucus in. If you
Yes.
if you're not close
So you
enough,
can see-
miss completely.
yeah.
It's very intricate work.
I can see that.
Yeah, it's pretty much surgery. But as you can see, I mean, I got some there, and that's sometimes all you get out of one drone is that little bit there. That wasn't the best job because, you know, no microscope again, but
Young eyes help.
I think there's some more there.
I agree with you.
I still have good vision. It's one of the few things I have going for me. I have bad knees, a bad back. More difficult than the actual insemination. Yeah, it really takes a lot of time to learn to suck up just the semen and not the mucus, like Steve was talking about, because that mucus will solidify in there and jam up your whole system. So the semen collection is more difficult, I would say. As far as the insemination, I mean, it's a little tricky sometimes to, actually have a diagram here. There's a thing called the valve fold. I'm not sure. Oh yeah, here it is, here. The most tricky thing is getting past the valve fold, and you kind of have to go in at just the right angle and manipulate the tip to kind of push it
And
out
even
of the
before
way.
that is,
Picture right
the,
there.
well,
Oh,
yeah,
thank you.
you
Yeah.
gotta grab a hold of the stinger,
Right,
and pull
yeah.
it out of the way without pulling it out,
Yeah.
and then you have to get through that valve fold,
Wow.
and then you have to make sure that you don't jam that tip too deep. I mean,
Right.
there's it's surgery for all intents and
It
purposes.
is,
like
really
you said,
is. Yeah. And I actually wanted to be a surgeon, but that didn't work.
Well, you're a bee surgeon.
I'm a bee surgeon now.
She's
Yeah.
anesthetized.
She's anesthetized, yeah, she's
Yeah.
out.
Yes, she is.
How
yeah.
long is she out for?
Maybe 5 minutes or
Yeah,
so.
4 to 5 minutes. Yeah.
Then she wakes up kind of slowly, and during
You
that,
hope.
yeah, you hope.
And what do you, what of course. What do
Yeah.
what do you use to put her to
It'd be
CO2.
CO2,
CO2,
yeah, carbon
okay.
dioxide. Yep.
Chamber with CO2.
No, there's actually, he doesn't have it on here, but the whole setup, if you guys saw upstairs, there's actually when you put her into a tube, there's actually a CO2 thing that can knock her out while she's in there.
Yep.
There's also, you can knock her out prior, but then it's harder to get her adjusted to where you want her. I mean, there's a couple different ways of doing it. You might get 30 days out of her, if that.
Yeah.
But in this case, when you diversify or have more drones from the same, you could do upwards of, 10 microliters per queen. She takes a lot.
Yeah, yeah.
It just depends on.
Okay.
Number 212.
Find it easily.
So you guys see what he's on the right? He has the stinger hook. He's got the stinger, and then on the left he's got basically a hook that he's going to pull the ventral flap down, like he's doing. Once he gets that, he's pulling the stinger out of the way. He's pulling that flap open, and then there's the pipette that he'll insert into. And And then he's got to get the right angle. So it's in.
I don't see cages, Jeffrey.
It should be in the Ziploc bag. Maybe I didn't bring it. You know what? I might be in my truck or something. Just use the regular cages. And now if you watch above, you could actually see it move right there. Then we go one turn. So now we've inserted about 8 microliters of semen. Back up a little bit just to keep the waist down. And we're done. And I take it and I carelessly throw this queen over towards these guys somewhere, and I let them try to look for it for the next 10 minutes. So right now we're giving her just a little bit of gas.
How do you know when you're giving enough gas?
You can see them quit moving. And then if you do it just right, you can get them to get their stinger just sticking out, just as they pass out.
Can you get away with like the little whippet cartridge size?
This is CO2.
See, he's got a nice big bottle.
That's not That's you didn't need that.
Really?
Yeah, there's a little one.
Okay, so there's a camera attached to that.
And most of the setups were adapted for those size.
Oh, she's sort of filming it.
Oh, I don't know. Just don't let people look at the chicks. And mind the drugs that are all over. Oh.
Give it a little bit of saline, lubricate it. Insert, we're in.
She kind of crowed it.
Okay, so we're flowing.
So it wasn't anything I did. She just kind of
Turn. Back up the pressure a little bit. I'm not sure why that froze. She's stuck. All right, here, Mark, catch.
Now, what are you doing at the end? What do you touch her with? Like, what's that do?
What?
At the very end, when you just down,
I take the pressure off so I don't lose semen, because otherwise it's under pressure and pull it out.
come back out. Okay.
So that's how we anesthetize her with CO2.
All right, Steve, we'll need another one. And we put her in a little tube here that has a block on it. And then the bees like to back up. So then we let her go into the holder. She wants to back up, back up, back up, back up. Whoop. And then I stick her on a little pedestal here. We get her going in the right direction. And we give her just a little bit of gas.
Those are the workers that take care of the queens.
Okay, you see her stinger sticking out there? Whoops.
Okay, so you see her stink sticking out? Is it on that video?
Yeah.
Okay. So this is just the way you want it, right there where she just has it sticking out. Makes it real easy. It's nice when it's easy. Otherwise we have to go digging. And that is, oops. Okay, so she's in about the right position. And we just need to move this ventral flap here so we can see what's going on. Well, most of the positioning is all done with the stinger side. This is just to be able to see things. And we move our pipette in. Right there's where we need to be. Just a little bit of saline to make things move smoothly. And we go in 1 millimeter. You can see we have a nice seal area on the left. And I turn a little bit to see whether we have a blockage. So it looks like we're flowing. And we do 1 full turn. You can see it moving on the left. Release the pressure a little bit. And back up. Look at that semen. There we go. There. I don't want to lose any. It takes a lot to get that.